This is One-on-One. There she is for the first time on One-on-One, Dr. Sheila Dynan, Dean of the new School of Health Studies at Berkeley College. I only call it new because it's new.
It's new.
Well, what makes it new?
Well, in July of 2013, Dover Business College and Berkeley College merged together, and they brought both of their healthcare programs together under one school, and that's the role that I have taken on as the leader of that school.
So break it down for folks, Dean. If you talk about opportunities in the industry of health studies, give us some examples of what's hot, what's happening, and what it means to the people watching right now on One-on-One.
Well, we're looking at info from the Bureau of Labor Statistics that tell us that healthcare is the growing industry, and there are
it's hot.
It is very hot, and there are certain areas that are growing. We're looking for people to work, patient care, one-on-one patient care. We're looking for medical assistants to go out and work in doctors' offices. We're looking for people who want to do billing and coding, which with the advent of Accountable Care Act is going to be...
Time out. Billing and coding, what the heck does that mean?
Well, it's how doctors and medical practices get paid. And they have to be in a particular format for the federal government to reimburse for Medicare and Medicaid.
Or you're not getting paid.
Or you're not going to get paid.
I would say that's important.
Oh, it's
right,
very
doctor?
important.
Right.
Very important.
That's a career.
Absolutely. Absolutely.
And you teach to that.
We teach to that, and people can come in and get their associate's degree on that, and then they can move right on up. We also specialize in making sure that all of our students have the practical internship experiences in all of the areas that they're going out to work in, so they get a true feeling of what those jobs are like. And I would like to make sure that the students that we train become the professionals that the professionals want to hire.
How do you do that?
Well, we make it realistic. Many of our faculty are also practicing clinicians. They have been out there in the world doing these jobs, so they're bringing back the experience and exposing the students to the...
Are we seeing some real life stuff right there, right in that video, that shot? I'll put it right there. Is that what you're talking about?
That's exactly what they're seeing. They have hands-on practice.
Makes a difference.
It does. And in many of the programs, they actually have to do what most people are saying in the industry of competencies. So if they're going to be a phlebotomist, somebody who's going to be drawing blood, they have to prove that they can do a good needle stick without hurting people before they can go on, before they can graduate, or before they can get certified by the accrediting bodies that we use.
Who are the students? Where do they come from?
They come from all over. We have students, we actually have 10 different campuses. Our programs are in 9 of the 10. And we have students coming in from Pennsylvania. We have them coming in from Westchester into New Jersey for certain programs. And we have a great presence in New York City. We have places in Brooklyn. We will be opening up new clinical programs in Newark and Middlesex on July 1.
Doctor, say someone comes in, they have a year and a half, they've worked in a hospital, they've got this clinical background, this training, but they've never actually gone to a higher education institution. Do you have a situation where you say, all right, you have the potential to use some of that practical experience to start with some credits. Can you actually do that?
What we will actually do, we have a couple of formats for that, specifically for people who have that kind of experience and training. One, we have a portfolio system where they can produce for us all of their abilities based on what they've done in life. The other area is that students may come in and take what we call a challenge exam.
Challenge
exam. If they know this material, we'll give them what the credentialing agencies require.
Right.
And they pass the test, we'll give them the credit.
How'd you get into this whole thing?
Well, I've been in education for about 35 years. And I've really varied in many of the things that I have done. Undergraduate-wise, I was health and phys ed, and then proceeded on. And at one point, I was coaching a lot, and was looking at the issues of my athletes, and decided I needed a little bit more background. And I went back and got my master's in social work and became a clinical social worker. And then I did a little part-time work at an emergency room, actually part-time for 10 years, where I was doing psychological evaluations on patients in the emergency room. So it's just a natural fit between what I do as a social worker and what I've always done as a teacher.
So when you think about, right, when you think about the School of Health Studies today at Berkeley and what a School of Health Studies might have been 10, 15 years ago.
Completely different.
Night and day.
Night and day. And I said to students at orientation earlier in the month that the jobs that they think they're having training for now, that's their starting point. But in 10 years, they will have a different job that hasn't even been invented yet. But they need to get in on that basic level and start to look around and see where the opportunities are growing.
You're not from New Jersey, are you?
No, I'm not.
Where'd you pick up that Boston accent?
In Boston.
Are you a Red Sox fan?
Yes, sir.
And you admit that?
Yes.
Even here in New Jersey?
I do.
We like that.
Yes, sir.
We like that. You don't like the Yankees?
I like the Mets.
Right answer. By the way, your chairman of the board likes the Mets too. Kevin Lewin, you know that?
Yeah.
It's important to know. It's irrelevant to our audience. I just happen to know these things. Dr. Sheila Dynan is dean of it is the School of Health Studies at Berkeley College. Happens to be new because they merged with the Dover Business College, right?
Correct.
And all sorts of possibilities. Dean, I want to thank you for joining us. We love our friends from Boston, and the Yankees will, in fact, be taking back the championship one day, and we'll be smiling, not you guys in Boston, right?
That's fine. Equal opportunity.
Yes, I like that. Thank you, Dean. We'll be back for one-on-one right after this, not talking baseball. Thank you very much.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by New Jersey's credit unions, the New Jersey Education Association, New Jersey Natural Gas, United Water, New Jersey Sharing Network, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.